The Epidemiology and Public Health group has been working during last years in 3 different areas. Firstly, collaborative projects of the European Commission to develop a universal influenza vaccine based on tandem core technology. Also in influenza, we have a project funded by the Instituto de Salud Carlos III to study the morbidity of influenza in pregnant women and their vaccine coverage. In the field of pertussis, we have been in another multi-center project to study the role of respiratory viral co-infections and the gene transcriptional profile expression in the severity of pertussis in infants. And in the field of preventive vaccines, we have been participating in several phase 3 clinical trials of recombinant herpes zoster vaccine to know the immunogenicity, efficacy and safety of this vaccine in different patients with immunosuppressive conditions.
The main research area of the Catalan Institute of Pharmacology is pharmacoepidemiology. Recently, in one of our main areas of research, that is blood dyscrasias and their relationship with the use of medicines, we have obtained a national grant from the Spanish Health Ministry to study the genetic determinants related to agranulocytosis and the use of medicines. Another area of research is polypharmacy and the elderly, and recently, during the last year, interrate liability study comparing different potentially inappropriate prescribing tools have been published in collaboration with the internal medicine service of these hospitals and 6 other Spanish hospitals. Another study aiming to analyze or to assess postoperative pain in the hospital has been carried out. And finally, we collaborate with the PROTECT project. An European national drug consumption inventory has been built, and all this information is now available in the PROTECT website, and a summarized version has been published in a peer-reviewed magazine.
In 2013, the group of Heath Care Research has collaborated in the development of a clinical practice guideline based on systematic reviews. The guide includes diagnosis and monitoring of pain, non-pharmacological interventions to prevent or treat pain, and pharmacological treatment. Another project was aimed to identify factors that determine adherence to long-term treatment in adolescents. The study involved 153 adolescents and their caregivers, and also health professionals. Other research projects related to patient care in critical care units. One of them about the prevalence of anemia caused by the realization of many blood tests at these patients. Another one related to quality of life in patients who require mechanical ventilation, and also about the stress factors produced by ventilation. With this project, funded by the Institute of Health Carlos III, 2 nurses of our group are carrying out their PhD.